I'm told we're back on. So, Ruby, if you would like to continue with your feedback on the annual public health report, that would be great. Thank you.
Thank you. I think I was just coming to a close, actually. But yeah, I think the report highlights the good work with other groups, and hopefully everyone's had a chance to read the report. I do have colleagues online who have contributed to the report, Sapna, Chauhan and Johanna, who's trading standards lead. But yeah, welcome any questions now or for later.
Thank you very much. That really was short and sweet. And I know that we've got some comms going out today, which is around that young volunteers going out and buying vapes, and our trading standards taking a dim view. So that's good to see. Does anyone have any input or questions or contributions? I saw Kerry first, and then BJ. Is there anyone else? We'll start with that. Thank you.
Thank you, Chair. Thank you, Ruby. Excellent piece of work. Lots of detail in here. Very well presented. In terms of engagement with schools and youth groups, can you give us just a bit of an idea of how that's gone?
Yep. So we have had engagement with schools through our Stop Smoking service, and I think that will continue. We're yet to do a wider piece sending this report out after today to schools in Ealing.
Thank you. And I would obviously, the Ealing Learning Partnership is a good partner there to be supporting that. Over to you, BJ.
Yeah, I was just going to echo an excellent report, and in fact, lots of learning for all of us in terms of the impact of vaping and how significant it is in the community. And I think there's still a lot of, as we know, a lot of unknown issues around vaping in children, and unknown answers to questions, particularly in relation to obviously nicotine dependency in children and the impact of that, and then secondly the chemical and biological impact of physically of the vaping in terms of the upper airways and the lungs and other organs. So I think there's still a lot of information and research that needs to be done in vaping in children to be able to establish what is going to be could potentially be quite a negative long-term consequence for children in adulthoods. And obviously it's important in terms of some of the legislative controls that have been put into place in terms of vaping, and everyone has to have a concerted effort to ensure that the illegal supply of vaping is to a minimum, but also a lot of work around the education of young people in relation to the impact of vaping and all the negative consequences of it.
Absolutely, Vijay. Thank you very much, and it's good to have the more clinical perspective. I did have a question from Councillor Brett.
Thank you for the report. You just mentioned about kind of working with schools and then subsequently then sending the report out. I suppose I'd be keen to understand kind of what actions you want from the school as well.
Thank you. Really good question. I think at the moment we're just sharing the information. I think schools are coming to a close with summer holidays right ahead. But I think it will be trying to build a more longer term relationship on this topic, and importantly working with our provider and getting that feedback, not just through this report but more widely, and how we progress with that.
Right. Any Gurpreet?
So working with our provider, Smoke Free Ealing, looking over at Chris, there is a pack that we're engaging schools with, that we have engaged a few schools with, and I think we can certainly make that information more widely available.
That's great. I mean, the more hands on deck with this one, the better. I mean, it's absolutely endemic. Right. Well, thank you very much for that. I'm delighted to let everyone know we're precisely on time. So I would love to hear more about the new diagnostic centre and the report that we've had. Who's presenting that? That's Simon's
online,
online.
I'm
Oh,
afraid.
forgive me.
'Cause
Of course, you're online.
Right.
Thank you, Simon. If you would again be gloriously brief, that would be great. But over to you.
Yeah, very happy to be brief. Just a couple of things there. Just in terms of ending the last financial year, we achieved our financial balance. We achieved the 78% target for patients seen with 4 hours coming through A&E, and that's a massive achievement given all the pressures of the increase we saw in demand through A&E, and we've continued to make progress in reducing we're eliminating 72-week waits and reducing the 75-week waits, and we're now working towards the target on 52 weeks. Yes, as I say, the emergency care activity last year was up 13% on 1920, so particularly challenging, and in particular I think our LAS attendances are significantly up as well. And what we also see is those concertina in the back end of the day between 4 and 8 o'clock in the evening, and it puts massive pressure on the department. One of the other things then we've coped with over the last winter was around temporary escalation spaces, where on times we're sort of caring for people on trolleys, in additional trolleys in the A&E, and also in terms of patients going up to the ward on a trolley, and they're cared for next to the nurses station or corridor in the wards, whilst we're effectively waiting for discharge the following morning before that patient could access a bed. So that's not an ideal scenario. It's something that we've had to do both on the Northwick and the Ealing sites, and it's something that we're working very hard to try and eliminate. But given the scale of demand and pressure we have, that is difficult. In terms of Ealing, some specifics around the positives is we expanded our recovery spaces from 4 to 10 on the site last winter, so we're able to increase our throughput through theatres. We awarded 5.8 million for decarbonisation project on the site, looking at new heat pumps, etc., being put in place going forward. And we've invested in our medical model in terms of increase the number of clinicians in the organisation to support the flow through A&E by increasing the number of staff, and that's covered on one of the slides in terms of some of the specifics around the numbers. And just to highlight, we did have some good support with bridging support and investment in terms of care homes services from relevant partners, and we continue to work with our mental health colleagues. So mental health has been a big challenge through the A&E as well over last winter. So that's the general update. There is a slide then, as you say, on the Community Diagnostic Centre. So we're delighted that opened in August 2024, staffed by a multidisciplinary team, nurses, radiographers, designed to address health inequalities, improving healthcare and access for all. Provides a range of diagnostic facilities out to the site in terms of ultrasound, CT scanners, MRI, etc. And we've hit, I think, something like 98% of our target plan for the last financial year in terms of what we're expecting to deliver in the opening partway through the year. And it continues to see ongoing usage going forward. So we're very pleased with it. Patient feedback is really positive. And then just in terms of the current financial year, like most NHS trusts, we've got significant CIP programme. That's 48.5 million for us. Our second big priority is around reducing those temporary escalation spaces I referred to, and we're looking to increase access to treatment by continuing to improve our productivity and efficiency through theatres, outpatient referrals, etc., day cases. And as well as that, recognising that we can't deliver our services without our staff, so continuing to invest in our staff through improved working environments, flexible working, and training and development, etc. But happy to take any questions on any of that.
Thank you so much, Simon. Particularly exciting to see that the ambition for the diagnostic centre continues, and looking at new pathways, but also increasing numbers. Does anyone have any questions? I saw Neha first, then Kerry, then David. So we take those first three. Over to you, Neha.
Thank you very much. Simon, I was at a residents forum this week, and the residents were curious to understand how quickly the results flow from the diagnostic centre through to the clinician who is then making a decision about what to do with those results. Could you give us a bit of a flavour about how that works?
So it'll vary for the different type of diagnostic and test, but it's no different, I don't think, in terms of our diagnostics through the rest of the hospital in terms of the speed and the response rate, and certainly they'll be communicated back to their GP in the same way and process. So I'd be interested to know if there are particular concerns or issues being raised with you that it's taking longer than people expect. That hasn't come to me previously, but if that's what's lying behind the question, I'd be interested to hear more.
Thank you, Neha. It's Kerry next.
Thank you, Chair. Thank you, Simon. Really positive, as the Chair's mentioned, in terms of the ongoing work around the diagnostic centre. I'm interested in terms of the performance improvements at the Trust, specifically at Ealing Hospital, and any reflections you may have on the good work of the Ealing Partnership around the use of the discharge fund and other work that's been done to support the flow of patients from hospital in good time.
Yeah, I think I alluded to the fact that there'd been increased investment in terms of supporting the discharge pathway. I think we have seen, despite the challenges, I think partners have risen to the challenge in terms of supporting us, but both from a health and also a social care perspective. I think that is working more effectively. I think we have a greater social care presence on the site, and the speed of decision making and prioritisation of patients has been extremely helpful, and we get decent representation in the urgent and emergency care board that I chair as well. So those things have definitely improved, and also from a community discharge perspective in terms of health services, we get good support from West London Health in that respect as well. The one challenge is around some of the inordinate waits for mental health patients in terms of our A&E department and moving those on. And I know that's been a challenge for West London, and I know they're taking action to address that. But generally speaking, we have an effective working relationship, and when things are escalated, people respond. But we'd like things to move quicker without the escalation, I suppose, is the bottom line. Wouldn't we all?
And over to you, David.
Thank you, Simon. Health Watchers visited the CDC twice, and we think it's a great facility. However, on both of our visits, we spoke with patients who had difficulty finding the location. I was just wondering, in the last year, in your own internal patient experience, has there been an uptick in people being able to find it easier? And how are your wayfinding efforts going so far? Thank you.
So if I could just add to that, I've had exactly the same feedback from ERSCAG, our social health and social care community activist group. So it'd be good to, it's clearly an issue.
I suspect it's probably because there are diagnostics on the Ealing site as well, and so yes, I'll pick that up and take that back as an action and come back to you. But I suspect we need to be really clear in terms of access to the diagnostic centre, as opposed to X-ray that's along a couple of corridors in the hospital. And people who traditionally would have come to the hospital for diagnostics might automatically find themselves in the middle of the hospital, and the CDC's right at the main entrance. So, but I'll take that back in terms of the specifics around the signage of the CDC, and also what is going out in the communications to people in terms of what to expect and to where to find it. So I'll take that back. In terms of wayfinding, as a trust, we are undertaking a wayfinding project, and we are working with a company who provide the same sort of wayfinding service to a number of hospitals nationally, and we had an update yesterday actually from Access Able, who are doing that in terms of a wayfinding guidance, and it'll all be linked to our website and everything else, and what to expect and where things are on site. So there's two aspects: wayfinding principles for the site, and then an Access Able review to there'll be a link from the Trust website from the Access Able details in terms of wayfinding across each of our 3 main sites, Ealing, CMH and Northwood Park.
That's great. If I could just stress the need for, we have plenty of willing volunteers if you'd like to sense check some of those before you get to the implementation stage, particularly around disability access. So do call on us if that can be helpful. Vijay, I can see that you're signalling. We have reached the end for this slot. I'm going to let you have a question, if it is a question. Simon, jump in quickly and respond to that. And then Vijay, if you could ask your question, and then we'll move on.
So if you've got some contact details of people who might be interested in supporting the wayfinding project, if somebody could email me a contact, I'd be delighted to follow up on that.
I'll do that. Thank you.
Thanks for that. Yeah, I certainly do also confirm in terms of some of the signage, because personally having to take my mother to the CDC, we struggle to find the cardiology section of it. So yeah, there's definitely some room for improvement in relation to that. But my question was, in terms of the 3 CDCs across North West London, you know, they are clearly available for all residents in North West London, and I understand, Simon, that we are trying to increase the activity throughput. So it'd be interesting to have a little breakdown of the demographics who are going to the Ealing CDC to make sure that we are promoting that CDC across other residents in North West London.
So Simon, if you could, rather than respond, if you could take that, we could take that way as an action. And I would add also that I know we had very variable referrals from our GPs. And that may well impact the demographics that we see in those people who are attending. So if we could have a roundup on that, and if you want any further clarification on what I mean by that, then we can chat afterwards. But I think that would be helpful. Thank you. Right, move. Our next issue is again from our public health team, and they're going to give us a very brief progress report on the Ealing Roots and Wings project, very close to my heart because it was rooted in the Race Equality Commission and the work demands that our Citizens Tribunal have made of us. I believe that we're going to hear from perhaps participants later in the year about the projects and how they're going. But if you'd like to give us a really brief update, Gabby, on where you are with the project to date. Thank you.
Right, thank you. So, sorry, just had a very short presentation, which I am trying to find on my screen. So we're coming today to really just give a kind of short update. As I say, we'll be kind of coming back, sharing with our participants at a later date. The Ealing Roots and Wings programme is a programme for up to 10 Black-led community organisations supporting health and wellbeing in Ealing, and has been funded by the NHS Health Inequalities Funding. And 10 organisations have received £5,000 grant funding to support their projects and peer research training for a Black leader within the organisation, as well as having access to networks and tailored training and participation in listening circles as well to address healthcare challenges. And the eligible organisations have been smaller community organisations with annual turnover of less than 200,000, and where they're at least 50% of board members are of Black ethnicity, and as I say, organisations supporting health and wellbeing. And this has all come from the Race Equality Commission. So we launched the application in December, and we received 37 applications by the close date in January, which was really exciting. We had a panel to agree our 10 successful organisations in February, and we onboarded them in March, transferring that £5,000 funding. They started, the Black leaders who were on the peer research training programme started their training in April, and some insights have been collected from them, and they are currently undertaking their training, their peer research projects. So from now until September, they'll be completing their peer research projects, and we'll have a showcase event in October where we'll also be launching the next round, where there'll be another 10 organisations who will be awarded funding and receiving the training. And until that point, we're undertaking ongoing evaluation to inform improvements as we go along, and particularly for kind of changes to the phase 2 process. And also looking for ongoing opportunities to build in this the voice of these participants and their leadership into decision-making forums. So this is just to show some of the 10 organisations who are part of this. So we have Descendants, Voices of Autism Network, Cane Women's and Girls Development Organisation, Westside Radio, HSENA, Zebra Sports, Ealing Somali Welfare and Cultural Association, Communicate Inclusively, Roller Dome, and Barqua Relief Organisation. And they've undertaken most of their training sessions, and so there's some photos here that that shares some of that. And within the insights, you will have obviously seen them in the report, so I'm not going to go through them, but they're on the screen at the moment. So if anyone has any, and it's actually quite small, I know, but there's there was some very welcome to be part of this, of being able to have their voice heard and to be engaging. But there are some concerns about kind of short-term nature of funding. There's a big question around kind of being asked to participate in projects without fair compensation. And just to highlight, within this, they are being compensated for their time spent doing the peer research. But I think more generally, looking to ensure that funding is bolted into times they're asked to participate. There's a need really for closer working together of organisations, and a better working and more culturally competent working with Black communities. I suppose one of the questions I have for Health and Wellbeing Board is, one of the real purposes of this is to build Black leadership into those decision making around health, and we want to really think of this as a long-term project, even though the funding may be just for 2 years. We want this to be thinking about this longer term and thinking about opportunities to have participants from Ealing Roots and Wings on on boards in discussions. So any thoughts about that would be welcome. And just to share also that this is a collaboration between we've got Ealing Council, we've got the ICB, EHCVS and Voices of Colour as well to run this project. So thank you.
Thank you very much, Gabby. I would say watch this space, but I think precisely the takeaway is that us sitting here discussing projects that other people might be better served speaking about themselves is something we can perhaps take away. Does anyone have any brief questions for Gabby? Councillor Steed.
Thank you. Thanks for the report, and it's really encouraging you had as many applications as you had. So the projects that they're doing, the 10 bodies that have been selected, are they choosing those topics, and are there any sort of KPIs which are then attached to those projects? Or
so yeah, that's a fantastic question. So the reason why we're taking this peer research approach is that this is very much about these organisations determining what the issues are for their communities. So they are determining those research questions based on what they know the needs of the communities are. And then obviously, so they're undertaking them at the moment. Yeah, as I say, I would love to be able to come back here with a sort of longer item and bring some of them back to actually talk about the projects that they're doing.
Put your mic on, please.
Which takes place in September, is that right?
So,
A midpoint check-in, whatever. I mean,
just to be clear, this isn't a conversation. This is a chaired meeting. So do you want to follow up on that? And then perhaps if you want to follow up as a separate meeting, that'd be helpful. Yeah.
Outside the meeting chair. Okay, all right.
I mean, I can answer that question. Yeah, so we're kind of at various stages. We've got a process to collect kind of sort of feedback and yeah, and kind of essentially to evaluate at various different points during the project. And there will be a evaluation that we can also bring if we can come back next Health and Wellbeing Board.
Thank you very much, Gabby. And to that point, this is very much embedded in our connected communities approach, which is a very acute understanding that our communities know far more fundamentally the issues that they have, and most importantly, they are far more cognizant of the ways to resolve them. So it is a slightly different way of working, and the council setting up a project and having a beginning, middle, and end. But it is, we believe, has far better outcomes and is absolutely integral to our building long-term and trusted relationships with our community. So thank you very much for that. We look forward to seeing some of the participants later in the year. Moving on to our final item, which is from David at Healthwatch on homelessness. I would just like to a precursor to what is an excellent report into an area that is quite hard to assess and to analyse and to get data and to have those conversations in a way that can meaningfully be presented back in terms of data. So I'd love to hear more about it, and thank you for your work.
Thank you, Chair. First, I want to thank the panel for allowing us to present here today. I'd like to thank my friends from Public Health who have already given their response to the report. Over the last year, we spoke with 27 people who did not have a fixed address, 14 of which were asylum seekers living in hotels, and 13 people who are experiencing homelessness, whether that be rough sleeping in sheltered accommodation, etc. Some of the things we found were discrimination in healthcare, whether it be perceived by the individuals we spoke with, or from GP practices themselves. 80% of the people we spoke with said that they felt treated differently because of their status. And a GP practice we spoke with said, due to their own feelings, they felt that they had to discriminate based on past experiences with individuals from this cohort. We found a reliance on the third sector because the public sector can't cover everything. There are naturally going to be gaps, and where those gaps exist, the third sector does operate, and it operates very well. Our friends at Hope for South Wall Street Homeless and REAP do a lot of good work, and for those who needed help accessing healthcare, dentistry, things like that in life, those organizations stepped in and helped to do so. We found that there is widespread isolation in this cohort. 83% of people we spoke with felt that they were lonely or isolated. This is especially common in asylum seekers who are living in hotels. Another thing we found was confusion regarding GP registration, misconceptions about what one needs to register with a GP practice. People think that they need an ID, they need proof of address on medical records, which is not required by NHS guidelines. Some of our recommendations include clear training for NHS reception and GP staff so they understand who can register and what they need to register. Strengthening collaboration between the public and the third sector, because our third sector partners told us that they notice issues of mental health in their cohort, and there's a lot out there that can help them. They don't know what it is in particular, and they don't know what the right pathways to refer are. Creating a task force that examines continuity of care, because people, when they are moved, will probably be moved out of London due to capacity issues. And if they have a chronic health condition, sometimes getting set up at a new practice can be harmful. Those are some of the insights in our report. I'm happy to take any questions, and thank you for your time.
David, thank you. So this strikes me as a particular issue that lends itself hugely significantly to partnership working, because it cuts across obviously our statutory responsibilities in terms of housing, the health work, and as importantly our voluntary sector. And while there is good work there, it strikes me that it's perhaps something we can discuss outside this meeting of where we might be able to do more targeted work. I can see a lot of hands have gone up, so if everyone could put their hands up again who wants to speak. I'm going to ignore all of you in favour of Councillor Brett, who are you okay if because obviously you hold the housing brief, whether you're happy to just do a little bit of on the sort of from the council perspective in terms of housing, and particularly temporary housing. It's obviously not a situation we want to be in, but perhaps some context would be useful before I hand over to Neha, Chris and Vijay and anyone else who wants to speak.
Thank you, Chair. Yeah, just in terms of, and I think probably I'll be preaching to some of the converted, because I know that a lot of you will kind of understand the pressures that the council are under. But we've got a kind of significant problem at the moment, in particular in the last kind of, I mean, it's been an ongoing issue, but I think really come to the fore in the last 18 months to 2 years in terms of people presenting as homeless. And obviously homelessness is multifaceted. You know, it's anything from families that have been had a Section 21 all the way through to rough sleeping. And so we've seen a kind of unprecedented amount of people coming through the doors. On average, per month, we're dealing with around 3,000 people that are in temporary accommodation. We have a significant proportion of families that are in bed and breakfast, which isn't suitable. So we are feeling the pinch. We are feeling a real struggle. What our housing department have done in terms of the homelessness side of things and rough sleeping, we had some really high numbers across the country, and in the last year we've managed to really reduce the numbers of rough sleeping and homelessness. And part of that work is fundamentally around really clear understanding of what the issues are, and working with our, as you put it in your report, the third sector partners that are picking up the gaps. And we wouldn't have been able to do that alone. It was absolutely in collaboration and in partnership with all of those kind of partners that we've had. And so I think that it's really useful that this report, and I'd love to kind of delve into how we work better going forward in terms of that as well. So thank you.
Thank you, Councillor Brett. I've got Neha, Chris, then Vijay.
Thank you very much. And we, as you will know, David, we're part of that partnership with the Homeless Health Board, really trying to support individuals in their individual circumstances. But it is still concerning that we're seeing those misconceptions in GP practices, and we'll take that away as a very clear action to reinforce that messaging with our GP practices about GP registration and not needing, and try and do as much and not needing that identification, and try and do as much in our public communications as well. Thank you.
Thank you, Neha.
Chris.
Thank you. I just wanted to say thank you also, David, for a really valuable piece of work, and also to welcome the messaging around housing within this space, because it's really helpful to think about the interconnections between the socioeconomic factors and health and care outcomes. From a West London Trust perspective, we've spent a lot of time thinking through the different aspects that Councillor Brett alluded to in respect of housing and homelessness on that spectrum, including the different needs of the different populations around the asylum seekers, individuals in temporary accommodation, individuals in housing who have care needs around their housing, and then those who are street homeless. And there are certainly services available in the borough that support the street homeless, and we've got initiatives including the Asylum Kitchen project funded through the council that supports individuals in asylum seeker hotels. Very keen to ensure that people have access and equitable access to services in the borough, and it particularly links also with the council's position around being a borough of sanctuary. So I think just to make a personal observation around the asylum seeker population that I met last time I attended the Asylum Kitchen, I was personally surprised by some of the restrictions on what they are permitted to use facilities-wise within the hotels, which I understand relates to the contracting of the hotels by the Home Office, including not being permitted to use any of the public spaces in the hotel. So I do think there are representations as a community we could make around what is dignified accommodation for some of those communities. Thank you.
Excellent point, and worth making the distinction between those placed in Home Office accommodation and those placed in our accommodation. Who was next? It was VJ.
Just want to say, first of all, thanks, David and Health Watch, for putting this report together. And I just wanted to follow up on what Neha said about GP registration for this particular cohort of population. As of this year, as part of the North West London Access Programme, we have a commitment for every practice in North West London to sign up to the Safer Surgeries philosophy around the commitment to reduce and mitigate any barriers to registration. So, I would expect there will be an improvement in terms of how GP registration happens in North West London. And the other thing just to note is that we've done a lot of work around in relation to promoting and engaging residents as well as GP surgeons around online registration. Ealing across North West London led that piece of work. We had the highest number of practices all signed up to online registrations across North West London, and a lot of work we did locally to really promote that. But now, obviously, as you know, it's a national program for online registrations. Most of our practices now have posters and QR codes on displays, so that you can basically just scan the QR code and register online. You don't need to actually physically go into the surgery to register. And we've also now, at another stage in that process, registrations now become automated so that the details land into the GP IT system. So so a lot of work has been done via NHS England and locally in RICB. So I would hope as time progresses, we will actually see a lot more improvement in that.
That is good to know, Vijay. So thank you for that. I would suggest that it's perhaps there's a piece of work, therefore, around our partner organisations and advice services and voluntary sector understanding more about how they can automatically register to GPs, because it's one thing saying to someone everyone is entitled to a GP. It's another having the mechanism for them to then do that. Is there anything you want to add to that, Gurpreet? Because that's your wheelhouse.
A lot of communities struggle in terms of accessing digital services. So I feel like more capacity building needs to be done with our local residents. And also a lot of them don't have access to digital resources. But I think this report is brilliant, and it kind of reinforces that we need to invest more in the voluntary sector and have more kind of health initiative roles that kind of navigate the health system.
Thank you for that bit of lobbying there. I couldn't agree with you more. But I think it's certainly, so this is clearly, and maybe I'm just as chair's prerogative. For me, it feels like a really health of those who are experiencing homelessness seems to be something that collectively would be worth some more focused attention from all of us. So perhaps if I can take that away as chair and have a think about how we might be able to get people in a room and like actually get some sort of action plan going. It's not necessarily something I would expect the council to run because I don't think we'd be best placed to do it. So I'm going to look to Gurpreet for some ideas about how we might facilitate that, because we're seeing that sort of approach of getting everyone, literally to get everyone in a room with representatives from that community, and it's creating really good outcomes and actions rather than talk and describing. And I think let's take that away as a bit of an action. Chris, I'm going to let you have the last word, and then we'll close the meeting.
Councillor Easter, I just wanted to pick up on the idea that you've had. I think we do have the foundations of that group, so maybe there's an action for us with Gurpreet to link with you about how the Homeless Persons Board has better resident representation, other partners involved, and that it feeds into this space.
Absolutely, anything we can do that precludes replication, but I think it'd be a good start to that conversation, and particularly with the Borough of Sanctuary work, because so many of our homeless are either asylum seeking or recently have leave to remain and are experiencing many of the same issues, and there might be some money that we can get from there. Who knows? We can but try, because I think it's the lens through which all of that needs to be looked at. Right. Well, how did we do? Well, it's we're 5 minutes over time, which I think is pretty spectacular. So I don't think we have any questions from the public. Is that right, Zena? So the date of the next meeting is Thursday, the 23rd of October. And unless anyone wants to add anything, say anything, any last words, I will thank you all very much. Thank you to Simon Online, and close the meeting. Thank you very much.